Before you book that knee surgery consultation, stop for a second and do this simple test with me. Sit down in a chair right now and slowly bend your knee as far as it will comfortably go. Hold for 3 seconds. Now straighten it back out slowly. Did your knee move smoothly, or did you feel stiffness, resistance, or a grinding sensation somewhere in that movement? If your knee felt anything other than completely free and easy, here is what almost nobody tells you. What you felt is inflammation sitting inside that joint, and inflammation is something the body knows exactly how to address when it is given the right support. The joint supplement market is worth billions of dollars, and millions of people over 60 take glucosamine and pain tablets every single day. Yet knee pain remains one of the most common reasons older adults end up in a surgeon's office. If those supplements worked so well, why are so many people still struggling to walk down the stairs without holding the rail? Here is the hidden answer. Most knee pain after 60 is not caused by a joint that is completely worn out. It is caused by ongoing inflammation, poor circulation, and muscle imbalances around the knee that nobody ever properly addressed. Single ingredient supplements target only one of those layers. That is why they so often disappoint. In this video, we will walk through 4 home remedies that work on different layers of knee pain at the same time, ranked from good to the most powerful thing you can start tonight. And remedy number 1 has more clinical research behind it than almost any other natural approach to knee pain, plus a preparation detail that changes everything about whether it actually works. Before we begin, tell me in the comments your age, the country you are watching from, and how long your knees have been giving you trouble. Have you ever tried any home remedies for knee pain before? Even once? I read every single comment, and your answers help me understand what people in this community are genuinely going through. My name is Dr. Natalie Brooks, and the reason I care so deeply about this topic is that I have watched too many older adults walk into a surgeon's office for knee pain that consistent, targeted home care could have significantly improved first. Surgery is sometimes necessary, but it should never be the first conversation. Let us start with remedy number 4, the one that most people dismiss because it sounds too simple to possibly work: Epsom salt soaks. Most people have a bag of Epsom salt sitting somewhere in the house. Most people use it occasionally for sore muscles and then forget about it. But Epsom salt has a very specific and very relevant action when it comes to knee pain and joint stiffness. Epsom salt is made of magnesium and sulfate. When you soak your knee in warm Epsom salt water, the magnesium is absorbed through the skin into the tissue surrounding the joint. Magnesium is one of the body's most important natural muscle relaxers. It helps the muscles around the knee let go of the tension they have been holding. And when those surrounding muscles relax, the pressure on the joint itself reduces. Imagine the knee is sitting inside a tightening tube. Every step you take adds a little more pressure. The muscles around the joint contribute to that squeeze, especially when they are tense from compensating for pain. Magnesium from an Epsom salt soak gently releases that squeeze, creating more space in and around the joint. Research has confirmed that warm water mineral therapy provides measurable relief from knee osteoarthritis pain and stiffness when used consistently, with warmth and minerals together, proving more effective than either one alone. Here is exactly how to do it. Fill a basin or bucket deep enough to submerge both knees in comfortably warm water. Add 2 full cups of Epsom salt and stir until dissolved. Soak your knees for a minimum of 20 minutes. The first 10 minutes soften the surrounding tissue, and the second 10 minutes is when the magnesium absorbs more meaningfully. After the soak, dry the knee gently and immediately follow with a light circular massage for 2 to 3 minutes. The warm, softened tissue absorbs that pressure far more effectively than cold or stiff tissue would, and the massage keeps circulation moving as you head into your night. Use this 3 to 4 times per week, ideally in the evening before bed. Used consistently, Epsom salt soaks reduce the background tension that keeps pain elevated and create better conditions for everything else you are about to learn to work more effectively. And this brings us to remedy number 3, the one that works from the inside out, and the one that most people use completely incorrectly, which is exactly why they never get the result they are hoping for. Ginger. Fresh ginger root has been used for joint pain management across many cultures for centuries, and in the last 2 decades, researchers have finally begun to understand why it works. Ginger contains natural active compounds that work specifically on the type of chronic, low-grade inflammation that sits inside aging joints and keeps them painful day after day, week after week. Think of inflammation in the knee like a slow fire that never fully goes out. Pain medications can dampen the flames temporarily, but ginger's active compounds work more like removing the fuel from the fire, addressing the chemistry that keeps the inflammation running in the first place. A 2015 meta-analysis published in the journal Osteoarthritis and Cartilage reviewed multiple clinical studies on ginger and knee osteoarthritis and found that ginger significantly reduced pain and disability compared to placebo across the studies examined. The effect was most consistent in participants who used ginger daily for at least 4 weeks rather than occasionally. Here is where most people go wrong. They brew a weak cup of ginger tea from a tea bag, notice nothing after a few days, and decide ginger does not work. Teabag ginger contains a tiny fraction of the active compounds found in fresh ginger root. To get a meaningful amount, you need fresh ginger prepared correctly. Take a piece of fresh ginger root about the size of your thumb. Peel it and grate it or slice it thinly. Place it in a pot with 2 cups of water. Bring to a low boil and then simmer on low heat for 10 to 15 minutes. Strain into a mug and add a small amount of honey and fresh lemon juice if desired. Drink 1 to 2 cups of this fresh ginger tea every day. The simmering time is what matters. 10 to 15 minutes on low heat draws the active compounds out of the root far more completely than simply steeping in hot water the way a tea bag works. Aim to drink this consistently every day for 4 to 6 weeks. That is when most people begin to notice a genuine shift in how the knee feels. And before we get to the top 2 remedies, if this video has been useful to you so far, please hit the like button and subscribe to Senior Health Advice so you never miss what we release next. What is coming at number 2 and number 1 addresses the deepest layers of knee pain and the most overlooked parts of the natural healing process. Remedy number 2. The ancient oil that modern research is now confirming does something quite remarkable when applied correctly to a painful knee: castor oil. Castor oil has been used across multiple cultures for thousands of years, and modern researchers are now beginning to understand why it works so well on joint pain. The key is a compound called ricinoleic acid, which makes up approximately 90% of castor oil. When this compound is absorbed through the skin, it has been shown in clinical studies to have genuine anti-inflammatory and pain-reducing properties in the tissue beneath. A study published in the International Quarterly Journal of Research in Ayurveda followed patients who applied castor oil regularly to painful joints and found a decrease in joint pain of over 50% and a reduction in stiffness of approximately 48% within just 15 days. Those are meaningful numbers for something that costs only a few dollars at any pharmacy. Here is how it works. When warm castor oil is massaged into the skin around the knee, the active compound penetrates into the tissue beneath and reduces the local inflammation that is contributing to pain. At the same time, the massage itself improves blood circulation in and around the joint, which accelerates the removal of the inflammatory waste products that have been sitting there amplifying the pain signal. Think of it like this. The inflammation inside a painful knee is like dirty water sitting stagnant in a drain. The castor oil acts like a natural drain cleaner, and the massage is what gets the water moving toward the drain. Together, they are clearing something that has been building quietly for a long time. Here is the exact preparation method. Take 3 to 4 tablespoons of pure castor oil. Warm it gently by setting a small glass bowl of the oil inside a larger bowl of hot water for 2 to 3 minutes until it is comfortably warm but not hot. Apply the warm oil to the entire knee, including the front, the sides, and the area just above and below the kneecap. Massage in slow circular motions for 5 to 10 minutes, working from the outer edges of the knee toward the center. After massaging, wrap the knee loosely in a warm cloth for another 15 to 20 minutes. Then rinse off with warm water. Use this treatment every night before bed. The nighttime timing matters because the body does most of its tissue repair during sleep, and having the active compound already absorbed into the tissue means it is working while you rest. If the oil feels too thick for comfortable massage, dilute it by mixing 1 tablespoon of castor oil with 1 tablespoon of warm coconut oil before applying. This does not significantly reduce the effectiveness and makes the massage much more comfortable. Aim for daily use for at least 3 weeks before assessing how the knee is responding. And now, remedy number 1, the one backed by more clinical research than any other natural remedy for knee pain. The one studied in randomized controlled trials involving hundreds of participants with knee osteoarthritis. And the one where the preparation detail makes the entire difference between getting the benefit and getting almost none of it. Turmeric. Turmeric is the bright yellow spice that has been used in South Asian cooking and traditional medicine for thousands of years. Most people know it as a flavoring in curry. What most people do not know is that the active compound in turmeric, called curcumin, is one of the most extensively researched natural anti-inflammatories in the world. A 2022 meta-analysis published in Frontiers in Immunology reviewed randomized controlled trials on curcumin for arthritis and confirmed that curcumin significantly reduced pain and improved physical function in arthritis patients, including those with knee osteoarthritis, across multiple studies. Now here is the preparation detail that most people miss entirely. Curcumin on its own is very poorly absorbed by the body. You can eat large amounts of turmeric and have very little of it actually reach the tissue where it needs to work. But 2 simple additions change that completely. The first is black pepper. Black pepper contains a natural compound that increases curcumin absorption by up to 2,000%. Up to 2,000% more effective absorption simply by adding a small pinch of black pepper. The second is a healthy fat. Curcumin is fat-soluble, meaning it needs fat to be carried properly through the digestive system and into the bloodstream. Without a small amount of fat, most of it passes straight through without being absorbed at all. Here is the golden milk recipe that brings all three components together. Heat 1½ cups of whole milk or unsweetened oat milk gently in a small saucepan on low heat. Do not bring it to a full boil. Add 1 teaspoon of turmeric powder, a 1/4 teaspoon of black pepper, and 1/2 teaspoon of coconut oil or a small knob of unsalted butter. Stir well until everything is fully combined. Add a small amount of honey to taste. Drink 1 cup of this warm, golden milk every night before bed. The bedtime timing is deliberate. It allows the anti-inflammatory compounds to work through the night while the body is in its natural repair state, doing the tissue work that happens most effectively during sleep. For people who prefer not to drink milk, you can make a turmeric paste using the same proportions and stir 1 teaspoon of the paste into warm water, soup, or a morning smoothie each day. Aim for at least 4 to 6 weeks of daily use before assessing how your knee is responding. The body does not resolve inflammation overnight, and the studies that show the most significant results are the ones where participants used turmeric consistently for 60 to 90 days. So there you have it. 4 home remedies working on 4 different layers of knee pain at the same time. Epsom salt soaks that release the muscle tension gripping the joint and create the conditions for healing. Fresh ginger tea that addresses the chronic, low-grade inflammation from the inside every single day. Warm castor oil massage that penetrates the tissue, reduces local inflammation, and improves circulation while you sleep. And turmeric golden milk with black pepper and healthy fat, the most research-backed natural anti-inflammatory available, taken every night before the body begins its repair work. You do not need to start all 4 at once. Begin with the one that feels most accessible to you this week. Add a second one the week after. Build gradually and give your body the time it needs to respond. Consistency over 4 to 6 weeks is where the real and lasting results appear. This is what Senior Health Advice exists to give you. The practical, research-grounded guidance that a 10-minute appointment rarely has time to cover. Explained clearly and built around what your body actually needs right now. If this video gave you something useful today, please share it with someone over 60 in your life who has been told surgery may be the only option. Subscribe to Senior Health Advice so you never miss what we release next. And leave a comment below telling Dr. Natalie Brooks which of these 4 remedies you are going to start with tonight. Your knees have carried you through every step of your life. Give them the right support consistently, and they have far more capacity to heal than most people are ever told.